The CDC is fundamentally a science-based organization, and they like to do things regarding guidelines and recommendations based on the data that they have. If they don't, they do modeling, and if they don't, they'll give you an expert opinion. And right now, the thing I believe that's holding back more liberal relaxation of the kinds of guidelines is the fact that we still have a considerable amount of infection in the community. That's the issue. And I'll guarantee you, Jim, that as the level of infection gets down, and we can get it down more and more by continuing this successful vaccine effort. Well, for example, what you can do regarding the workplace, what you can do even more so regarding travel. I mean, the CDC made it very clear that the travel guidelines, even though they say it's still, given the level of infection in this country and throughout the world, it is more risky to travel, obviously. But if you are vaccinated, that risk diminishes greatly. So I think what people need to understand that these are recommendations. They're not things that are binding in the sense of any kind of a penalty if you do or do not do that. So people will look at the guidelines, and then they will have to make their choice about what degree of risk they are willing to take and what kind of risk aversion they have, as opposed to saying, well, I absolutely can't do this because the CDC says not. They're based on science, and that's the point that they've been all along. When you're getting a formal approval, you have to have a certain amount of time just observing predominantly the safety, and obviously the safety looks really, really good in well over 140 million people having been vaccinated with at least a single dose. That's the kind of thing that the FDA will do as expeditiously as possible. The impact that the vaccine is having, it's even better than what you would have expected. We're seeing the number of cases go down. We're seeing people in the elderly group, the number of hospitalizations and deaths going way down. It's all as a result of vaccination, Jim. And that's the reason why you hear all of us in the public health sector essentially pleading with people to get vaccinated so we could crush this outbreak.